Today was the second meeting of the Sports Coalition, where we're trying to bring together not just the combat sports organizations here in Las Vegas, but all of the sports organizations here in Las Vegas to talk about the issues of brain health and to try to get everybody on board to support two things. Number one, of course, you got to raise money for these projects. They take money to fund. But number two, to make sure that we have the athletes and the organizational knowledge as part of this study. So we're very, very excited about it. We've got essentially every sports organization that has some roots here in Las Vegas here today, and it was a great day. A lot of progress was made. In addition to that, we also had people from the United States military today who came up with a great idea of including the military in this study because of the situations that occur there. So, really excited about the direction of this organization, the scope of it, and what we can do going forward.
Now, the goals of this professional fighter study include detecting the earliest and most subtle signs of brain injury in those exposed to head trauma using MRI imaging techniques and other clinical measures, determining what risk factors make an individual exposed to head trauma more likely to develop chronic neurological disorders, identifying those individuals by tracking brain function over a period of time who are progressing toward developing long-term neurological diseases such as chronic traumatic Alzheimer's or Parkinson's disease, and providing information to guide athletes and empower them to make informed decisions.
We felt like from the very beginning, we wanted to let our athletes make informed decisions. In order to make informed decisions, you need information, you need education, you need to be part of something. And so that's why once this idea was floated to us and Top Rank stepped in and so many other organizations also stepped in, I think all of us said, wait a second, all we want to do is make sure our athletes have the best information, and in order to do that, you got to do research. So that's why we did it.
Well, it's extremely important for this. I'm just going to stick with football because that's what I know. For the future of the game, the numbers of kids playing football is dwindling because of the head injury cases, and so the more information we have on how to protect and get kids back from concussive episodes, the better. Unfortunately, it doesn't do anything for the guys that already have it. They'll be able to tell you what you have, but there's no pill. So. I'm hoping that I want to keep the game alive. I love the game of football, and they have to do something to make it safer.
Well, in our fighter study, we have about 800 subjects, so probably about 500 more active fighters that are competing now. We have about 100 or so retired fighters, and then we have another group which we call controls, and these are individuals who are probably pretty much the same age, education, but have never been exposed to head trauma, and so that's a comparison group. We hope eventually to add new groups to it. We're starting to add bull riders to our group. We hopefully will add other sports to see if some of the findings that we're collecting from the fighters actually apply across sports, whether it's bull riding or hockey or rugby, because if we find a tool that can help us determine and detect injury early, the hope is it can apply to any sport.
From the beginning, our first focus was, okay, what can we do to help our athletes, take care of them, to give them more information so they can make informed decisions. But we realized pretty quickly that the applicability of what we're going to learn through the 800 athletes right now that are part of the study is way bigger than MMA or boxing. It's way bigger than sports. It has applicability to people, throughout the world, whether they're having brain injuries through, their occupation, or whether it's just something that happens to them as a result of the normal aging process. So, it's something that we're really, really proud of, to have an impact, frankly, that's just way bigger than we are.